I've been working as a dermatologist for the past 18 years at the hospital, and over the last 3 years I've been head of dermatology. Eczema is a very severe disorder in children. It is one of the commonest skin disorders we see. It presents with very severe inflammation, redness, scaling, crusting of the skin in certain areas, and the most debilitating symptom is the itch and scratching.
Flynn suffers from eczema. It flared up when he was roughly 6 weeks old. You know, when you've got a little baby and the first thing people do with a new baby is they pick him up and give them cuddles and oh, how beautiful. Flinny never had that. This little boy was just in so much pain, and as a parent there was nothing that I felt I could do. Change a laundry powder, change his diet. Is it something that you're eating? What are you washing him in? Like, what am I doing wrong for my baby? The advice that we were given at that time probably wasn't the advice that could fix him. But if a GP was able to tell me, you need to do X, Y, and Z, and this is what's going to help your baby, oh my goodness.
One of the problems we have when patients come in is that they believe the cause is a food allergy. The problem is eczema's, genetic, you're born with it. And the second myth is that topical steroids are bad, and they spend all the time avoiding topical steroids. It just gets worse. And it is one of the most difficult things we find even amongst dermatologists to treat, because by the time they get to see us, they've had a lot of different ideas and they've been to lots of different doctors. It's not very well known amongst doctors exactly what the protocol is, as we haven't had the opportunity to make an exact protocol. So the number of patients referred to Princess Margaret Hospital with eczema is quite large and unsustainable for non-urgent cases. They basically go on the waiting list, which at present is 3 years.
I finally got that referral to go and see Dr. Brand. He said, I'll see you back in 10 days. And I was like, oh, okay, he's going to see a difference in 10 days. I haven't seen a difference in 18 months. How am I going to see a difference in 10 days?
The treatment for eczema is very simple, and it involves using regular moisturisers, short baths, and being free to use enough topical steroid ointments, and doing wet dressing treatment, which can be easily taught within a few minutes to any parent. But most cases are on the mild side, so they will be able to manage it quite easily. They'll probably clear a lot of cases that never ever have to be referred. It is not as simple as just putting extra funding in for increased staffing, as eczema education is much more important on the primary GP level to reduce the number of referrals, as even if we had double or tripled the government funding, we probably wouldn't be able to see all the patients that are referred at present. And as eczema is not a life-threatening condition in most cases, it comes quite low in the priority list. So our main aim at present is not so much increasing government funding, but to increase awareness and education amongst the community to reduce this 3-year waiting list. So the most important thing is that eczema is treated early at the primary care level, and that GPs are educated in knowing how to do this. The aim of the project is to have enough funding to employ a nurse practitioner full-time over a period of 3 years, and they would then be able to deliver the protocol to all the general practitioners, nurses in practices and pharmacies in the community. And the cost of doing this would be $800,000 we established, and that would cover the full-time salary of a nurse practitioner and all other costs involved in developing this project and protocol.
I remember when I went back to Dr. Brand, I was like, did you know you were going to fix my child? He's like, of course I did. Of course I did. And I was like, oh my God, we followed your plan, and this is the outcome. And I have this beautiful baby boy. And if you saw him now, oh my God, seriously, I've never seen him so happy.